Can you hear me?
I think we're live now, aren't we?
Are we?
MCTV, are you on? Are we live?
You guys are live and ready to go.
You know if Malcolm's going to be in?
I just hung up with Malcolm. He got his mixed messages, so he thought it was at 4. So he's getting in just a minute.
Want me to wait?
I think we can start if we want to hold my presentation for a little bit, so that we can get Don Bracken. Oh, there you go. Don's on, and we can get his thing ahead of my presentation because he needs work. He has to do a bunch of work.
I'll just I'll call the meeting. I'd like to call the meeting to order. Good afternoon, everybody. This is September 17th, 2020 Board of Health meeting. Just like to remind everybody that this meeting is being recorded by video and audio. And pursuant to the Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order that they were raised. If you do not have an audio capable device, the Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. All questions should be directed through the chair. For attendance purposes by roll call, could the board members please acknowledge that you are present as I see you? Melissa Murphy.
Here.
Jim Cooper.
Here.
Meredith Lepre.
Here.
Malcolm McNabb.
Here.
We also have Art Crowley from Board of Health, Assistant Director. Roberto. And also joined today for later on in the agenda is Don Bracken from Bracken Engineering.
Yeah.
Okay, so any public announcement? Public comment? Do you see anybody that's raised their hand? Not at the moment.
No hands are raised right now.
Huh?
I think we're good.
Oh, we're good. So we'll go right to you with the director's report.
So I'd like to defer my director's report to the item number 7, which is the COVID-19 item, so that we can do the other stuff on the agenda first.
So net review of the minutes, August 20th, 2020. Any additions, changes? Okay, get a motion to accept the minutes.
So moved.
Get a second?
Second.
Okay, all in favor by roll call. Melissa Murphy,
Aye.
Malcolm McNabb,
Aye.
Meredith Leffery,
Aye.
Jim Cooper,
Aye.
and Steve Isco, chair, says aye. Number 5, emergency due to sudden erosion, discussions regarding the variance for 287 and 289 Hummus Pond Road, which is map 83, parcel 39.
So we've had some pretty sudden erosion in that area. So this is a project that we were working on here on our staff, but with the erosion that's been happening, have to take action a little bit quicker. So Don Bracken is here, and Don, I'll let you take the floor.
Sure. Can I share the screen? Okay.
You can.
Okay, this was the last site plan that we had reviewed and applied for variances for, if you recall. It's 2 properties. There are 2 houses, one at 287, one at 289. The one at 289, which is the one to the east, the foundation for that building is currently exposed to the ocean. The erosion has gone up to the corner of the garage. So there's, in that corner, last time we looked at the plan was 33 feet away. So they've lost, roughly 33 feet in the last week or so. As of today, our environmental consultant was out there. There's still a lot of wave action. There's still a lot of movement. Hopefully the next couple of days, things will die down and we'll be able to go out and reevaluate and see where the new top of the coastal bank is. The contractor has been working with the Conservation Commission sort of as an emergency to get the house removed, get the contents removed. They actually demolished the existing garage in order to have space to access where the building is. So as of this morning, they were taking pieces of the existing building apart and trucking it out and trying to get the contents out. I'm not sure where they stand this afternoon or tomorrow, but hopefully soon they'll be able to pick that existing house up. And the plan is to move it and sit it down next to the existing house at 287 until we can figure out what the next course of action is going to be. That's sort of where it stands right now. We understand that the conditions are completely different. We actually had the plan ready to submit to get the actual permit. We received the variances from the Board of Health, but we didn't receive the permit yet because we went through conservation, got that approval. And like I say, getting ready to submit for the septic permit. Obviously, we held back. We understand that it's not the same conditions as what you had looked at last time. So I think until this thing settles down and we know where the new top of the coastal bank is, we'll probably, hopefully, come back with some other options if we can figure out any other options. So that's sort of the update. I'd be happy to answer any questions, or if you have any feedback on what the future might hold, I'd be happy to listen.
Do you have any questions for Dawn?
Donna, what are you asking, to put the variance on hold? Is that what you want?
Yeah, I mean, I would say, yeah, we're gonna have to revisit the whole thing. The variance, is really not gonna apply anymore because it was all based on the last location of the coastal bank. So even though you've given the variance, you haven't really given a permit yet. So we can't really act on the variance until at the time we submit a permit. We understand, obviously, we've got to come up with a completely different plan at this stage. I think one of the options that we're hoping for is that, instead of putting in an IA system with a new leaching system, is maybe a tight tank option. If you recall, the last time we went through this project, it was very convoluted. We were taking two houses and combining them to one and going from 5 bedrooms to 3 to 4 bedrooms. And so I think that was the only reason we were able to get the variances we got. But now that this situation has come up, I mean, one alternative that, we may explore and come back to the board with is just demolishing the existing 287, taking the house that's being moved away from the erosion now and putting it back in that same footprint, and maybe just proposing a tight tank for that rather than the system that's designed. And that way there would be remaining at the two bedrooms, so that there definitely would, obviously the houses wouldn't be there, but it would only be a 2-bedroom house on a tight tank, which is exactly what's there right now in the house that's being moved. So I think most likely that is what we would be exploring later on.
I don't know if you've watched the extended forecast, but we actually have another hurricane that's going to be hit by Bermuda on Monday, and they've actually projected it to maybe make a slight turn towards New England with that for those days, the astronomical high tide. So we've got an idea after Tuesday of what's. I hope it doesn't erode more, but it may not be too good.
No, no one is jumping to make any decisions right now until, like I said, it calms down and we see what's left and what we have left to work with. So again, we're not really looking for any decisions tonight. The board was notified by the Conservation Commission, and I asked to be on the agenda to just update everyone, answer any questions, and just to keep in mind that we may be back in the future for something else once we know what we have.
So are we going to vote on condemning 289 as it is now, like as an emergency condemnation order? Roberta?
Sorry, my microphone was off. I don't believe we're in the process of doing an emergency condemnation order right now. I believe with the house being up and off, it's just completely inaccessible at this point. I think it would be just a little redundant to go and slap a thing on.
Yeah. Well, we'll just wait for Dawn to come in with a date.
Yeah.
What they think they need to do.
And I'm pretty sure, Don, you know the neighborhood pretty well, so it's not like it's going to be on stilts for 3 years.
We'll see how much they want to keep investing in this. That's the question. Must have a lot of sentimental value.
Okay. Does anybody else have any questions for Dawn, or could you drop that screen when you get a second?
Oh yeah, sorry.
Okay. Thanks.
All right.
Any other questions? Art, have any questions?
No, we'll just wait to see the plan. What he just mentioned, that proposal, I think would be, favorable. I mean, trying to help somebody save their property. There's not enough room for a septic system. having to clean up that on the beach at some point is a little easier than a leach facility and the rest of it. And like you said, how much money do you want to keep investing into a property that's sliding by? So we're pretty good.
Thanks. Thanks, Tom.
All right, thank you.
Okay, next, Board of Health policy on time frame from converting from IA septic systems to connecting to town sewer.
Yes, so currently we have the 10-year blanket variance across the island for anyone that's, if sewer gets in front of them, but they had turned in an IA, installed an IA system in the previous years. We gave them a 10-year blanket variance before they had to connect to sewer, variance from Regulation 69. So this, with the incoming, pushes up for sewer, and with all the PFAS that might push us to doing more sewer in other areas, things like that, we're looking, this was requested to be put on the agenda to relook. So if you remember, we did 10 years, but the discussion was also 15 and 20 years. So it's on the agenda so that we can have that open discussion.
Okay, let me, I'm going to throw this out there to the rest of the board members to think about for a second. So there's a lot of systems, IA systems especially, that we made people spend a lot of money to install. So by changing this policy today, I think we should make the policy retroactive to include the people that have already a few years ago and 10 years ago, and some of them 15 years ago, that have spent that money, lots of money. And that way the time clock can start from today, whether it's 15 or 20. Personally, I would like to see 20 years from potentially the install date or the date of the certificate of compliance that's issued by the board.
So that, Steve.
We'll start with Malcolm.
Yeah, I support this. I did some calculations. I just dragged them out, and I'm sorry, I was thinking it was 4 o'clock and I would have had it all ready for you by then. But looking at the permits back in 2016, there were 15, and now they're about 110. So Nantucket has already spent $5 or $6 million of their money. And I'm not sure that's fair, because to me, the preservation of our harbors and our ponds is a Nantucket problem, not a Nantucket problem. And they're on their, if we'd sewered when we wanted to, we wouldn't have this issue. And Nantucket residents have paid, I say, $6 million. You keep flying it, they're going to have put in as much money as it would be to sewer it. And when I did the calculations a few years ago, assuming that the sewer would be in complete in 2025, if you go out about 10 or 15 years, you only have about 10%, 12% of the residents that ultimately are not sewered if they are on IA system. Now, if you want, I can redo those calculations, or we can go ahead, but I support an extension. I would go 15, and we can always make it retroactive. And if we get our act together and town gets our act together and we sewer it, then we can adjust it accordingly.
Jim, you want to?
Yeah, my question was, if we pick 15 years, does that mean each person, no matter when their system went in, would have 15 years? So everybody would have a different date. Is that what you're saying?
Yeah, that would be like starting from today if we accept that policy. That's even people that put them in years ago.
But what I'm saying is if someone put it in 2010 and you give them 15 years, okay, and then the next guy put his in 2015, he would get 15 years? Or would everybody start at the same date? That's my question.
Well, the people that had put theirs in prior to this date would be starting at this date, and then people
Okay,
2 years from now or 5 years from now, their date starts at 15 years from the time it was installed.
okay, great. All right, I understand now.
Melissa,
I was just going to add that I agree with Malcolm. I think this is a nice solution for residents who are making the investment and don't get caught having to pay twice if we do get to sewering Nantucket. So I support this.
And then I think Bill Greeter has his hands up.
go ahead, Bill.
Good afternoon. Thank you, Steve, and the board for considering this change. Nantucket Conservation Association has been at the forefront trying to get our members to step up and do what was right way back when the Board of Health first recognized the need for folks to start replacing their systems with environmentally friendly systems. And it's been quite a push, and we've taken some flack from our own members for doing so. But this would be a very much appreciated move. I can tell you, as far as the folks out this end that have taken this as a serious need, and oftentimes have made some sacrifices and given up doing other things to do what was right for their property, and because, quite frankly, it was a mandate from the town. So I wanted to extend that premature vote to say thank you very much for considering this.
Thanks, Bill. Did you have anything to add?
Just that, you know, if you're going to make a motion that, you know, it's clear that the start date is today on your 15 years for systems prior to today, and going forward, it would be the certificate of compliance, and that would be about it that I can think of. Yeah.
Malcolm?
Yeah, before we go forward, I just want to make it clear. I support this, although in some ways, I'm sad that we actually have to do this, because the IE systems are better than conventional, but they're not as good as sewer. And we really need to push to get sewer out there. This is a fair thing to do, but not the ideal thing to do.
And Charlie Stott has a...
Melissa? We'll go with Melissa, and then we'll have Charlie come in.
Thank you so much. I just wanted to make a disclosure in the meeting, and I'll also be filing something with the town clerk, but as an owner of Mainstay Property Management, we are the deeded property managers for cottages and one townhouse in Nantucket. So we are responsible for paying bills on behalf of owners. I don't own the properties personally, but I just wanted to disclose that in this meeting, and I will also file something with the town clerk.
Charlie, go ahead.
Yes, thank you, members of the board. I want to thank you for considering this this extension of time. It's particularly important to some owners who have perhaps had to, in the last 10 years, let's say, install a new Title V system. And then if they wish to add a room to their house, for example, they would be required under Regulation 51 to install an IA system and then incur further expenses of having to connect to town sewer. So it's an awful lot for certain owners who would have to pay three different costs for a Title V, an IA, and then town sewer. So thank you so much for considering this.
Okay, thanks. Malcolm?
Just a point of order. Do we have to do a public hearing to this, or can we just make a motion here?
No, we can make a motion because it's just a variance
Okay.
to the regulation that's already in place. We're not changing the regulation itself.
Well, I move that we change the time to 15 years and not 10.
Retroactive for the prior system.
Yes. The way you described it, Steve, with the dates and the retroactivity.
I'll
Can I get a
second that motion.
Okay, all in favor by roll call vote. As I see you, Jim Cooper,
Yes.
Meredith Leffery,
Yes.
Melissa Murphy,
Yes.
Malcolm McNabb,
Yes.
and Steve Visco, chair, says yes. Okay, thanks. Okay, Roberto.
All right.
Discussion of COVID.
So we have, let me share my screen here to the good old fashioned same template. So we have good news today. We've only had one case come in out of the over 100 tests yesterday. So that's really good. We're hoping that this is slowing down, but we can't get complacent. The getting 5 cases or so every once in a while is going to be the new normal. So we just have to keep an eye out there. So we've had 8,338 cases. 2,900 of them have been through the CastNet. The surge numbers are slowly decreasing now with the testing, even though it is still crazy out there. And I'm sure Meredith can attest to that, how crazy the line can be. We are seeing a slight decrease. It's a small slowdown. So to quick overview, Labor Day weekend, people started getting a little relaxed over the course of because of the course of the summer being so strenuous and everyone paying attention, that it was really easy. People let their guard down, and we ended up getting 39 cases in the last 10 days. So we have contact tracing has gotten a lot easier. The large scale push that we did, where we reached out to grocery store owners, we went to each individual property with care packages and information regarding contact tracing and isolation and quarantine. And then I also participated in the bilingual parents school meeting, and it put a lot of minds at ease about what contact tracing actually is. And as a result of that, we've been actually very successful in picking up and filling in those gaps. So we actually had a meeting today with the state's contact tracing collaborative, where they were actually able to map the full outbreak. There are still some gaps here and there where we can't directly connect small branches of the outbreak, but they were able to actually trace it to a person who visited a family who visited Boston and met with somebody in Boston who actually was showing symptoms but didn't know they had it. So that's exactly how it was brought back to the island. So really quick, same metrics from yesterday, but with today's number in it, which today's numbers are a lot easier. So this 1% is the overall testing, but we're now back down to below 1% positivity on a daily case rate. So 2.64 positivity over the last 7 days, but that is much better than the 4.9 that we had starting the week. So it's down by about approximately 50%. We still have not received the sewer report for this week, so I won't be able to show that today. So we're still keeping an eye on it. say the new metrics. I was able to just finish this under the wire, so I'll be putting this up later today. But it's 55% male, 45% female, and this section here is what we want to look at, where between under 20, 20 to 29, and 30 to 39 is the great majority now. And it is what we're finding is people for age 40 and above, they have really heeded the warnings. They have really understood where the virus is, what it can actually do, and how devastating it can be in that population. So what we're seeing is a lot more, for lack of a better word, compliance of the COVID rules. Real quick, the race breakdown here. Still, the single largest group is still white non-Hispanic, but with the recent surge in cases, Hispanic in general has been now over 50% of all the cases since March. This is not the breakdown of the newest outbreak. Point of origin is still 66% Massachusetts. So we're now at that, people have paid attention to the travel orders. So we're not seeing a lot of that big interstate and intercountry travel that we normally see. So if you remember when I first started doing these breakdowns, out of state was still such a much larger portion. So as we enter the fall and the winter, the Massachusetts slice of the pie is going to start getting a lot bigger. I'll probably start breaking that down even further to Nantucket and other Massachusetts towns as well, so you can see what that slice is. So this is our cumulative incidence from the very start. This is our outbreak right now. So you'll see that it went all the way up now to above 100. So it's a direct spike. And that's what you see here is more than almost 40% of all of our cases were from these last few days. And like I said, sewer, we haven't received our sewer break yet, but David says that it's on its way. He's checking with BioBot every day to make sure when he gets it. Once he gets it, he's going to get it right to me and I can give it to you. And then using the same information from flattening the curve from yesterday, we're looking here, as you'll see, we're starting to flatten that curve, which is really good. So this is from the last a little bit over 30 days. I have this going from August 1st as the y-intercept with a 7-day moving average. So that's what this trend line is, the dotted line. You'll see that it was actually really low at first. And then once we had this spike, even though this is from daily incidents, by the way. So even though we've had the spike, we still have about an average, a 7-day average moving from about 4.5 cases a day, now down closer to around an average of 3.5 cases a day, 3.6. So that's an excellent trend, and we're hoping to keep it that way. The enforcement and outreach, and that's the conversation we're going to have now, is we're looking to do step 1 and 2. We do have some fines that were issued. We're collating that information out. Nothing from the newest, from the last 10 days or so, but we are responding to a lot of cases, a lot of calls. So I'm going to quickly stop the share. So what we're seeing is we're now that the information's out there, we're getting a lot of phone calls and emails saying, calling in job sites, groups like that. Like I mentioned yesterday, I'm hoping that as people call in, they call us when they see it. So today, one of the things that happened was we got called about a group out in Nashop. We went out immediately, but by the time we got there, the crew was already gone. So we don't know how long there was from when the person saw the landscaping crew out there to when they called us. And they didn't provide any information about what the landscaping company was or not. So if you do see it, and if we don't confirm, what we can still do is follow up with the company. So if you see a company out there that has their name on the side of the truck, and whether it is landscaping, cleaning, painting, construction, HVAC, any of those groups, just give us a call. If you can take a picture, better. and we can always follow up with the company. We can only act upon what our agents of the Board of Health see, so we can only issue fines from what the agents see. But even if if there's a witness statement, we can at least send a warning. We can say this was reported to us and get more information and do those as warnings. And but with the trend going down, with the curve staying pretty static, R hovering right around that 1 number, I wouldn't recommend any direct enforcement now. Not enforcement, sorry. Direct intervention, like shutting anything down, doing any direct limitations. I think we're headed in the positive direction. This surge in cases and this outbreak that we're currently in, I believe, sent the message that we were looking for it to send without us even having to get out there and sending all those messages. So people are back to wearing masks a lot more. It's really easy for the pandemic fatigue to set in. So we're really happy to see that. And I want to keep the discussion open with you. But as of right now, I wouldn't recommend limiting anything in any of these trades yet. I would maintain it open for at least another week, and we can keep an eye out.
Malcolm?
Oh, yes, I'm sorry. Yeah, I think as you point out yesterday, you go back to March or April, we really didn't know very much about this virus. Now we have better contact tracing. We understand the death rate is not as high as we used to think. Hospitalization is not as great as it used to be. And we used the shotgun at that time. I guess my question is, I'm encouraged by what I see, but when do we take the shotgun out again? In other words, what is the metric? We kind of always talk about, well, we may have to shut things down again, but what number will we see when we'll actually do that?
So what I would like to use as that metric, actually, it was suggested yesterday by one of the select board members that in an email, sorry, not during the meeting, in an email that I should use that R calculation as a metric because we're doing that 7-day R calculation. So using a 7-day positivity. So I can look at that and I can add the R metric. If the R reaches 2, where it is exponential growth, I would say that would be the trigger.
No, that's correct. Actually, that's of all the metrics we're using, now we can actually calculate that and not just guess at it.
Correct. I know Meredith had a question too.
Meredith?
Thank you. I'm just a little concerned about the possibility of asymptomatics because they're not really being tested. I mean, I just think $150 is a lot of money, and why are we not? Would the state where we're red now provides? I know they have mobile testing units, and what can we kind of do to make sure this doesn't happen again? Because I know a lot of families really want to start school, me included, in person, and I think it is maybe short-sighted of us to sort of think that this surge is over when we've had just a couple of days with not many cases and we're not able to do asymptomatic testing. It seems like everywhere else in the state is doing it. Why are we not able to do that?
I'm sorry if I led you to think that. The surge is not over. It's not over. We're still just monitoring. We're just monitoring. We're heading in the right direction in the trend, but the surge is not over. We're still in the midst of it. We received communication today, actually, from the state, trying to set so that they can set up an appointment with us tomorrow to discuss the red designation. And in that, we've already sent our request through the town and through Julian Sear and Dylan Fernandez to ask for a stop the spread location here on island. So tomorrow's meeting with the Emergency Operations Center in Framingham, we would probably be able to get that request in as well. So it's unfortunately with the Stop the Spread group, it is up to the governor whether he wants to sign that. It is not.
Thank you.
Roberta, maybe you could explain to him what you found out about being red and how they calculated the
yes. So
population.
Actually, let me pull up Dr. Brown's email. It's quite enlightening, actually. So, and I'll forward this to the board as an informational forwarding. We don't respond to it so that we don't break the open meeting law. It's just informational purposes only. But what we're looking like is, and for some reason I'm blanking out. I'm missing it here. Here we go. So I reached out to Dr. Catherine Brown, who is the lead epidemiologist for the state. She works with the Bureau of Infectious Diseases, asking, why are we using a census population? So the calculations are based out of 11,399, which is the old census number from 2010. So I explained to them the information about what we've learned through NDP, the data platform. I forwarded them the data platform report and saying, our population is closer to 17,200. So Dr. Brown responded saying that it's really surprising that she sees that from us with such a sound metric, and she's going to push it forward to her supervisors, which is the director of the Bureau of Infectious Disease, because the way they got their information was from, it says here, DPH contacted with the Donahue Institute several years ago because they had developed an estimation method for updating population numbers annually. The estimation numbers are based on the census and then the ACS done during intercensal periods. Although I'm not a subject matter expert on their methodology, my understanding is that it was done specifically to avoid this type of problem. So she's going to forward my email and our concern, the town's concerns about using the proper population to the state and to, I had that to Jana Ferguson, Ron O'Connor, Gillian Haney, and Dr. Brown. Those are all the policymakers in the Bureau of Infectious Disease and the Office of Regional Health. So if we can get Mary Lou Sutters, who we're going to speak to tomorrow, who's the Secretary of Health and Human Services, if we can get them to use the real number, the 17,000, that actually drops our incidence by over a third because they're using the wrong denominator. So every single case is accounting for a much larger percentage than it should. So this sort of epidemiological mistakes and calculations can skew an entire response. If we were to use the real number, we'd be in yellow right now versus red.
And we won't get asymptomatic testing.
Right.
It doesn't work to our advantage.
I was about to say the obvious point is that we're better off with their numbers for assistance.
Yeah, it's a very good point. We wouldn't get the asymptomatic testing through Stop the Spread. So we'll be talking to the state tomorrow, and we'll be working out a plan so we can have that discussion.
Malcolm?
Just additional what Meredith said, we do have funding to support some testing. And what is the status of that and how much is left?
I'll have to connect with Chris Dwowacki to get the exact number, but I believe we've used over half of that already. And then, but I'll get the exact number, and as soon as I get that from Chris, I'll forward that. I know Jimmy had a question, but there's also a question from the public that we can get. Jimmy?
Jim?
So Roberta, are you basically saying you're satisfied with the way things are going right now?
I'm satisfied in the trend in where we're going. We're not done, but we are moving in the correct direction. So I would say that we still hold off on any enforcement orders.
Well, my question is, I drive around constantly in the caretaking business I'm in, and I see blatant examples from building and landscaping people every single day. So are we going to just let that slide by, or are we?
No. It's not that we're going to let it slide by. We're still going to step up enforcement, and whenever we see it, if you see it, get it to us. You are an agent of the Board of Health as a Board of Health member, so we can act on the information that you have. So if you forward us that information with what you saw, or if you have a picture, we can issue a fine on what you saw.
But from what I understand, you're going to find the $300 for 3 times in a row. So I mean, I'm not in favor of that at all. I'm in favor a little bit of putting the hammer down on some of these people that are very blatantly. I was on my way home and I drove by and there was 4 guys in a driveway landscaping. And I stopped and got out of my truck and I said, look, I'm on the Board of Health. I need you guys to put your masks on. They didn't even have them. They were in the truck. And these 4 guys are working all day long in the driveway. So, I mean, it's blatant. Some of this stuff is blatant.
That if it was 4 guys on that site like that with no masks, that wouldn't be a $300 ticket. That would be a $1,200 ticket. Because it's
so. Do I have the right? Do I have the right to do anything about that if I'm right there?
Get that information to us, and we'll take care of the ticket.
And if you go out there and they're gone, then what happens?
From what you saw, you're as a member of the Board of Health, you're able to take a picture of the property and what you saw, write down the landscaping company, and get that information to us as basically an inspection report is really what it is. And we can act on that information. We can mail them that ticket.
Okay.
And I know there's a handout from the public, so let me.
Go ahead, Jonathan, if you hear us.
Yeah, hi. I have a question. What is the actual rule with respect to a group of landscapers or anyone? Is it that they have to maintain 6 feet of distance, and if not, they have to be wearing a mask? Or how many people can be in a truck at one time? I'm not entirely sure. Do they have to have a mask physically on them that they can adjust if someone comes within 6 feet? I also similarly have seen a lot of, throughout the summer, a lot of people just standing around in groups without masks, and I'm just not sure what exactly the rule is. And my other question was, what are we doing, if anything, to enforce the quarantining for the people who are testing positive?
Okay, so I'll take them one at a time. The first question is actually in 2 parts. So the governor's order number 31 requires that if you're going to be within 6 feet of somebody, you have to be wearing a mask. So that's at all times, but that 6 foot separation. If they're in the truck, they're obviously not 6 feet apart, in which case they should all be wearing masks. So we would be able to enforce on that. However, we also have the local order number 12, which requires masks at all times, even on private property, within the 2 districts, the downtown district and the Sconset district. So if they are on any time working there and they're not wearing masks, we can issue a fine because they're supposed to be wearing masks at all time in those 2 districts. So we're using both orders. As far as the quarantine order, we actually do have every person who fills out the travel order, we get a copy of the travel order with proof of testing and everything like that. The issue that we're running into, and as I explained at yesterday's select board meeting, is that unfortunately, when a person fills out the travel order and gets the information, those are people who are actively trying to pay attention to the rules. So there is a self-selection bias there, where we'll be biased to people who are paying attention to the rules and quarantining. So when we do check up on them through the list that we have, the confidential list that the state gives us, when we do check up on them, they're actually paying attention. So they're unfortunately not the ones we should be worried about. It's the people who are not filling out the travel orders and coming anyway that are causing more difficulties in enforcement.
But I'm talking about this group of people who are on island. Are we who have now tested positive? Are we enforcing their quarantine in any way? Are we monitoring that?
Oh yes, those current cases, all the current population, we do have somebody who is going out.
Okay,
actually, she's out right now, is visiting these properties.
Okay.
Meredith.
Thank you.
I don't think everyone that's positive is getting a phone call from the state or getting followed up on. And I know that from people that I know that have tested positive, they're not getting that's not really happening. So I just don't know what we can do to.
Are they getting your contacted from our local contact tracer?
Yeah, one phone call.
Okay, so they are getting the one. So the state isn't duplicating any of our efforts. If we have already marked it as contacted, the state's not going to contact them. The state picks up any of the cases that we haven't picked up within 24 hours.
I guess, and I think the person that was just speaking, the question is are they getting followed up on once they test positive?
Yeah, to make sure they're paying attention to quarantine. Yes, we have a local staff member who is driving around checking on these properties.
Okay.
I know Bill.
Hi, just one question. I know I'd actually, I think, brought this up for conversation previously, but as Roberto just said, there's a lot of companies that try to do the right thing, and their crews are doing what they should be doing. And oftentimes it's the smaller guys. And one of the issues is, because the vehicles aren't identified with a company name, unless you get a license plate number or whatever, if you're driving by, it's very difficult to do. Same was when they're doing fertilization, and you see somebody there and you go, I think that they're, there's a question of whether they're using too much fertilizer or whatever. Is there any thought to the next go round of licensing landscapers to make it a requirement that their vehicles be identified with a company name?
We could definitely add that to our regulation. That's definitely something we can do. We would have to go through the public hearing process again, but because of the new rules on, we would have to do that as a separate regulation. We would have to do that as a new regulation because fertilizers, our fertilizer regulation was put in before the state took over fertilizer regulation. So we were grandfathered in, but we can't do any changes to the current fertilizer regulation without going through all these crazy state hoops. So we would probably have to do that as a separate regulation, not necessarily tied to just fertilizer. But yes, that is definitely something we can look into.
Yeah, I mean, the reason I'm asking is my wife told me today she was out on a walk with a friend. They were masked up. They were walking a neighborhood in the core district. And there was a landscaping crew that wasn't masked up, and she mentioned something to him, and I don't think they returned a complimentary response, but there was no name on the truck, so she couldn't identify it. So anyway, just a point of consideration. Thank you.
Absolutely, thank you.
Melissa?
Melissa, I think you're muted.
Oh, sorry. Okay. Thank you, Bill. And I think, unfortunately, there's quite a few incidences I've been emailed about, not even just workers, but community members and people asking other people to put masks on and getting disrespectful responses from some members of the community, and whether they're seasonal residents, visitors, people who live here year round. It's, you never know you may not know who you're talking to. And unfortunately, I think there's certainly no excuse for bad behavior, but it's very difficult to, track those people down or report them. And certainly we don't want to encourage people to get into confrontations or hostile situations. So I like the idea of asking businesses to identify themselves. I think that's harder with some of the smaller businesses, maybe in house cleaning or painting, where you've got just 1099 subs running around. There's no official business name. But I think it's a good effort, and we can put it out to the business community to help us help them by having their vehicles identified or identifiable. And we probably want to talk with Bill Pittman about what some of those, if there's anything we need to, if there's anything we need to hear from him to consider any in the regulation like that.
Actually, thank you for bringing that up about the 1099s. That is an issue that we're running into across the board along, not just tied to COVID. So one of the things we've seen is with COVID, if you remember when the PPP came out and things like that, and the new unemployment benefits came out, we had a lot of employees who work for a lot of our construction and landscaping. Primarily, we saw it in the construction groups that are, because they were because they were 1099s, they didn't necessarily qualify for PPP. And a lot of people, and they didn't qualify for some of the unemployment because they were working as, quote, consultants, even though that is not correct. It is something that was brought up actually to the State House today by the Massachusetts, or yesterday by the Massachusetts Association of Health Boards, because the 1099 issue is actually akin to tax fraud. It's a way that some businesses are using to get around payroll taxes. If a person is doing work for you and is taking direct orders from you, you are technically their employer. A 1099 should only be used as a consultant, where they work with a specific scope of work and you work on a task list, not through direct order. So that has been a big issue that was being brought up. And it is exactly what you were saying. You know, we're seeing the same thing. They're an independent contractor when they're really not. So I see that there's still another hand up. I'm going to, if you don't mind, I'll add that to a lot of talk.
Oh, I meant to lower my hand, sorry.
Oh, okay.
Sorry about that.
Okay. And with that,
Does anybody got any more questions for Roberto or?
Yeah, Steve. Roberto, where does the school system stand on a return date for the students? Do you have any idea what's going on?
as of right now, the return date is still October 1st, but it all depends on that red designation. If the red designation continues on, we're forced to go remote. It's part of that DESI guideline. I know it's really frustrating because I know with the private schools don't have to follow the same guideline. They're basically allowed to make up their own metrics. But our schools' hands are tied to that state, the green, yellow, and red map.
Okay.
Meredith?
I'm just wondering, I know because I've been knee deep in this all summer with the school, it seems like DPH, DESI, and Mass General have all very different guidelines, and where we are sort of, because we are isolated and sounds like won't get a mobile testing unit, we're sort of tied to what Mass General says, but not necessarily, like they don't have to agree with all, everyone says something a little bit different as far as guidelines for testing. And so I think when you speak to the state, it just would be helpful to bring that up, that we don't really, not that the hospital is doing a wonderful job. It is really hard working in that portico. Like, I have been there a number of times. It is a lot of work. I don't know how they're doing as many as they're doing because it is exhausting. But I just wonder, like, would that take some of the pressure off of them doing 200 swabs in a day to doing a more easier handled number if the state was allowing us? And you wouldn't also get people coming up lying saying that they have symptoms just because they want to get a test because they may have been exposed. So I just think we need to really advocate for our town with the state, because I think that having asymptomatic testing is really the only way we're going to be able to control our current situation. And maybe and those are my thoughts on it.
Absolutely.
Malcolm?
Just one other point, get the name of the committee, the Economic Recovery Committee, whatever, has asked us to look at order number 11, where outdoor dining is extended to November 1st and whether we would extend it. My recommendation is not to do that right now until we see where we're going. We still have time to do that if we think it's safe to extend it beyond November 1st. But just for those people on that committee, that's my recommendation, that we wait.
Absolutely. Sorry, something got in my eye. So I had to. Yes, we definitely still have time, and it is. We're headed in the right direction. I wouldn't recommend taking a vote on it now.
Yeah.
But we're going in the correct direction.
Is that it? Any other questions? Okay. Any other board concerns or updates? No, seeing none. Are we good? Can I get
Good.
You good? Okay. Can I get a motion to adjourn then?
So move.
So moved. Out, second.
Okay. By roll call vote, Melissa Murphy,
Aye.
Jim Cooper,
Aye.
Malcolm McNabb,
Yes, aye.
Meredith Lepre,
Aye.
and Steve Visco says aye. Okay. Thanks everybody.
Thank you.
You.
Okay. See you, Art.
Take care.
You first fell in love with Nantucket. From the second you step on island, you'll know why you came. Enjoy the beautiful beaches, ride on the bike paths, and hike the trails and the open spaces. You can still enjoy your favorite meals, shop your favorite stores, participate in some of your favorite events, and take part in the magic of our Nantucket in a new way. Enjoy your visit and make some great memories of this once-in-a-lifetime experience on Nantucket.
I'm Martha Turk, Administrator for Nantucket Census Complete Count Committee. Today I'm talking with Jackie Echevarria, Tiamir Ivanov, and Vanessa Rendero about the 2020 U.S. Census. We know that many members of our community have questions